Any last little pearls of advice you'd give other physicians, clinicians, therapists?
Just one, I would think, and it has to do with the tone of this talk here, is that when I've had physicians in therapy, psychiatrists in therapy, then they talk about this. And I think it's a real challenge. There's something about the whole energy of medical school and doctoral programs, internship, residency, practice itself, that it's so hard to honor what we're talking about here. You know, I mean, it's so hard to, there's almost like the imperative of continuing to take on more what you can realistically take on. And it's a systemic kind of thing. So it takes a real courage and interior resourcefulness to pause, just to pause and reclaim your deepest convictions about what motivated you to want to do it in the first place. So you don't lose your soul in the process. And if you feel you are losing your soul, to be a contemplative healer, but a contemplative patient, and tend to what you need to give yourself permission to be present to your own life. Because everyone you see will benefit from that if you do. And in a way, it's interesting. I was giving talks like this, and there was an anesthesiologist on a retreat like this, and he said, he came up to me and he said he never thought of it this way before. But when he meets the person before surgery, and they sign off and permit they do this little thing, he said he realized that they were literally putting into his hands the gift of their consciousness. And that moment of eye contact where he touches their shoulder when he walks away, it's what humanizes the work and helps them realize almost kind of the sacred quality, of the technical procedure he's going to engage in. And I think keeping in touch with that is what it is that lets the work be exhausting but also nurturing. Because if it's not nurturing, the exhausting part tips it over, and you end up a cynical physician who's drinking scotch every night to get to another day, going and face the bull crap.
Right.
And it just gets, anyway, that's what I think is the big thing,
Yeah. Thank you.
You're welcome.
Thanks for taking